Which of the following best describes her condition? 55-year-old woman with a history of poorly controlled hypertension presents to the ED complaining of severe chest pain and shortness of breath. Her blood pressure is measured at 210 over 120, and electrocardiogram reveals ST segment elevation, several leads. All right. Poorly controlled hypertension, severe chest pain, shortness of breath. It could be unstable. Other than controlled hypertension, hypertensive crisis, hypertensive emergency, hypertensive urgency. And she has ST segment elevations. It's more than just unstable angina. Her blood pressure is very high. I just don't know the difference between, it's not malignant hypertension. I don't know the difference between urgency, emergency, and crisis.
Okay.
But I would think if she has the ST segment elevation, that's an MI. So I would go emergency, but I'm not sure. I don't know the difference between those words.
Okay, good. So emergency, right? You have huge, significant elevated blood pressure,
Okay.
but right, you also have right associated in organs damage, right?
Okay.
So she has like MI kind of symptoms, right? Or
Mhm.
AKI, stroke, hypertensive crisis usually right encompasses both hypertension urgency emergency but not specific, right? So they're really not gonna, this is kind of a lame shot here. They usually don't test it like this, so don't worry about hypertensive crisis. It's not really specific enough. Hypertension urgency is significantly elevated blood pressure without evidence of end organ damage, so they
So
might
that would be
test.
like the unstable angina then maybe if there's chest
so
pain with urgency or no?
so okay, I want you to remember here. Okay, hypertensive urgency and emergency, they're separate diagnoses from what you're thinking about of angina.
Okay.
Okay. They'll test anginas in a group collected by themselves.
Okay.
Okay. So unstable, stable versus Prince metal, right? That just means chest pain dealing with different things. But when you're dealing with hypertensive urgency or emergency, that's just really high blood pressure with and without, right, end organ damage. That's how you determine the difference. And then
Okay.
malignant hypertensive is severe form, very high blood pressure, retinal hemorrhages, papilledema, right? Pressure is really, really high. And then you have usually retinal findings, which they don't really mention here.
Okay.
Unstable angina is that even at minimum or at rest, you have chest pain and you don't have ST elevation on an echocardiogram. That means
Okay.
that you have like a 90% coronary blockage, but it's not 100%. And
Okay.
so even sitting, you have chest pain because your heart is not getting enough oxygen.
Okay.
So